My name is Lisa Liberatore, and I've been in practice for 15 years. Well, I think we try really hard to make the patients feel relaxed and comfortable right from when they come into the office. The staff is just, I'm really proud of my staff. I think that they, they just mimic my philosophy in making patients feel comfortable. We try to make patients feel like it's a family here, and I think that really sets us apart, just that alone. I have always felt that the best way to treat patients is to have a holistic approach, because you can't just look at a patient and just look at their nose or look at their throat or look at their, you really have to have that overall perspective if you really want to make an impact. And we're constantly looking for better ways to do that. Well, the feedback from patients is that they feel that they're surprised that their recovery from surgery was as easy as they expected. Sinus surgery is, definitely evolved, and during my career, it went from the techniques had changed during that time, but I would say the past year and a half, I adopted a more minimally invasive approach using balloon sinuplasty, and that I think has really expedited the patient's recovery even more. So the misperception can be because in the past we used to use a lot of packing, gauze packing, which we don't use anymore. Patients are always surprised that they're not going to be black and blue or swollen. They're surprised about the pain, that there's not much pain. Very often patients say they didn't even take the pain medication that was prescribed for them. So I think the misperception may be because the techniques were more aggressive in the past. I'm most proud when I see a patient who has been passed around from doctor to doctor, not getting any relief or help. Very often it's because I feel that nobody was really listening to the patient. And if I'm able to offer something and there's clear understanding of what the expectations are, that I'll try to do my best, but it may or may not be all that they want it to be. And then afterwards, seeing the look on their face when it just took that simple procedure to change their life. I think that's what I'm most proud of, that it doesn't always take some major operation. It takes listening to the patient and doing something which may be very minimal in terms of aggressive approach, and yet the patient has a very dramatic improvement from that.